Hi, everyone. Dr. Linda Matteoli, and I'm here to talk to you today about how to ask for local referrals when you're building your practice. Now, this is a question that I commonly get, and I believe it is one of the quickest ways to build your local practice is by reaching out and speaking to other local health professionals. So I'm going to take you through a process that I did myself when I was building my practice, and really proved to be effective in me building my practice that first 9 months or so. So the first step is going to be to data dump, make a list of potential referrals. So what that might be are local primary care doctors. This is for if you're not functioning as a primary care doctor. So in my practice, my specialty was like integrative lifestyle functional approach, but I did not do the typical primary care things like the screenings, the pap smears, things like that. So I was not in competition with local primary care doctors. So make a list of them: gynecologists, physical therapists, occupational therapists, chiropractors, speech pathologists, athletic trainers, acupuncturists. So anybody that would potentially work as a, if you're creating a tribe for your patient population, because we can't be the end all be all for everybody. We'll need to refer them out for certain things. And so just starting to think about like who do you need to potentially create a network for your patients on their healing journey? Because likewise, there's reciprocity there. Likewise, these other health professionals will need somebody like you to help them help their patient the best way possible as well. So you're just kind of making a list of people that you may need to refer to and who you might have some common patients with. So that's step number one. Then you get a little bit more micro with one practice. So you identify one practice. So say it's a primary care doctor, Dr. Smith. Just research a bit about their practice, and as much as you can, if something makes them unique or what have you. And then you would reach out. So you could reach out either with a phone call, an email to their office manager, or you could stop by. And so if you were to call the office, so this is, I always kind of reached out with a email and a phone call was typically what I typically started. So I would ask to speak to the manager. And then my script was typically something like this, like, hi, I'm Dr. Matteoli. I'm a board certified family physician, but I specialize in functional medicine, integrative medicine. I don't function as a primary care doctor. I noticed on your website that you work with kind of A, B, C, like kind of let them know that you've kind of looked into their practice. And I'd love the opportunity to learn more about your practice, as I believe what you offer really complements my approach to patient care as well. Is there a good time to have a conversation about your practice, or who may be a good referral for you? And then you kind of wait and see what their feedback is. There's going to be some people who this really is something that they want to explore with you. And they may say, no, and that's okay too. So if you are able to talk to the provider, or make an appointment, or just even move along more with the manager, then you would just kind of ask them, okay, so what kinds of patients do you see? Like what kinds of referrals do you accept, or do you work with? And that kind of line of questioning works particularly well with even more of the allied, like the PTs, the OTs, the acupuncturists, like what kinds of conditions do they specialize in? So you kind of have an idea. It's really important here to actively listen and then repeat back to them so they know that you're understanding. So take notes and say, okay, so what I'm hearing is that you work with these kind of population. The most ideal referral would be this kind of person with this kind of ailment or disease. It's just so you're kind of clear, and then you're building your referral list, from that anyway. And then how you lean into how to kind of ask for referrals back is you would then start talking about, the types of people that you see. So you kind of create a little bit of a bridge there. So say you in your practice, you deal a lot with people with more vague symptoms, or symptoms that sometimes can be more difficult to treat in the conventional world without more of that lifestyle arm. So say it's, something like migraines or chronic fatigue or something like that. So you could say something like, in my practice, I see a lot of patients with migraines, chronic fatigue, and a lot of times they've done the complete workup in the conventional medicine space, and they've seen the specialists, and they're at a place now where they're kind of managing their symptoms with prescriptions. And so what I'd like to offer you is that is what I specialize in. And so I work on working with their lifestyle and more of like a deep rooted approach of the cause of that. So if you feel like you have this patient, this 43-year-old woman who's been having migraines for the past 10-15 years, and you feel like you've done everything you can possibly think of, referred them to everybody you could possibly think of, and they're on multiple medications, and they keep looking to you for another option, please keep me in mind, because that is my ideal patient. That is who I work with. And I'm not in competition with you, because I don't function as a primary care doctor. I'm not actually really like a primary care doctor that I could refer back and forth with. To ensure that my patients are well taken care of. If they seem, if they seem interested at that point, then you would then say, I'd love to stop by and drop off some business cards and some more information about my practice. And then at that time, you could also offer them a foundational assessment or initial consult with you, either complimentary or 50% off. Because the more that these other allied providers know how you work, the more comfortable they're going to be referring to you. So you could offer them that assessment where you go through their blood work and you kind of discuss how you integrate that lifestyle integrative component to healing. And that really helps to solidify your relationship with them. So then once you have that conversation and you drop off your information, I would include, especially for health professionals, including like a CV or resume within a folder that you drop off. So you would have a letter on a letterhead in that folder where you kind of revisit your conversation, so that would be something that would be a good idea to write right after your conversation with them or their manager, where you say, we spoke today about this, and I understand that these are the types of patients that you see. This is who I see. As requested, like, here's some more information about my practice. Please reach out to me anytime. You leave your email, your cell phone, if you feel comfortable, anything like that. And then leave them some business cards as well as the foundational assessment postcard. So the foundational assessment postcard is located in the incubator course, but it basically discusses what the foundational assessment is and what they can expect from it. So it kind of takes them, you're anticipating the next step. So if somebody's interested in your practice, then they know, okay, the next step would be to schedule this foundational assessment. So it's important to include those as well. And then follow up. So give it a week or two. I wouldn't wait any longer than 2 weeks, and call back or stop by and just say, I was wondering if you had any additional questions, or if I could be of any more service to you. And at that point you could, if you hadn't already, offered to do the foundational assessment as a complimentary service, if that's something that they would want to do. This is also an additional opportunity for those community education, community talks. So if you guys are really kind of brainstorming together and kind of working together, especially if this is a privately owned practice, then they're also an entrepreneur and they are trying to, create a good environment for their clients and patients. You could offer, I also do community talks. I'd love to do a talk on thyroid or gut or whatever it is that you practice. and offer that to their community and say, I do this as a service to the community, and I give some really great steps that they could take to start improving their health right away. Is that something you'd be interested in too as well? So to just kind of revisit that, the initial phone call is the hardest. And it's something that you just kind of have to do, and you can't make it mean anything. So I probably called, I mean, close to probably 30 or 40 different offices or places. And I probably had under 5 that I really created a nice rapport with and a good referral network with. So you're not for everybody, and that's okay. You're not for every other, referring provider, and you're not for every single patient out there. So just kind of be solid in who you are and who you treat and how you do that, and be comfortable and confident in that. It's not to say that you're not going to feel funny about this. This isn't a typical thing that we're used to doing as physicians. And that's okay. It's just some discomfort, but some really beautiful networking relationships will come from it if you keep at it. So I hope this was helpful. This is one of the best ways that I have seen to get new patients, as well as to create a really beautiful tribe, not only for you, but also your patients as well, which is a nice thing overall. So go ahead and start with that list. Take that first step, take that first phone call, and make it a point to reach out to a few different offices, a few different practices a week, and see where it leads. All right, good luck. Thanks a lot.